Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute and the Center for Men's and Women's Urology here in Portland, Oregon, coming to you today with another segment. And I want to talk to you about a condition today called Staghorn Stones. Now, what does this mean? This means that you have kidney stones that are so large that they are oftentimes taking up the entire volume of the kidney, or a small portion of the kidney. Basically, they are too large to pass on their own. They typically don't cause pain, so a lot of people don't even know that they have them. What are they associated with? Well, typically you can get recurrent urinary tract infections or see blood in the urine. Or sometimes patients will go to their doctor for routine blood work, annual exams and the like, and they will notice a decrease in kidney function with their blood work, which then prompts imaging studies. So really the only way to know if you have these very large kidney stones is by imaging studies. So CT scan, ultrasound, X-ray. Lots of times they are radio opaque, meaning they show up on flat plate X-ray. So just standing there taking the flat picture of the abdomen. So if you are somebody that makes kidney stones on a regular basis, this is certainly something that can develop. What it entails is a little crystal that then continues to form and gets bigger and bigger until it finally creates a stone that's so large that it's too large to pass. Now, having said that, how do we take care of this? Well, it depends on the size of the stone. If the stone is of a size where you can actually go up into the kidney with a laser and break it up, we can accomplish it that way. Now, usually that takes 2 or 3 different procedures, and it exposes the patient to 2 or 3 separate episodes of general anesthesia. The same can be true if we use the shockwave lithotripsy, meaning some patients several years ago were put in a bathtub and we used ultrasound to break up the stones. We can now do the same thing with a patient laying on the table and just sending ultrasonic shock waves to the stone to break it up. Now again, that's under general anesthesia. So sometimes it takes multiple episodes of general anesthesia and the risk of that. When the stones are so large that we can't do multiple procedures like that, or it would not be advisable to do multiple procedures like that, we have to do a procedure called a percutaneous nephrolithotomy. And what that is, it's a big long word that means we put a little tube down through your back into your kidney. We dilate that hole that we make, and we put in a sheath about the size of my thumb. That sheath goes right down into the kidney, and we put a camera right down into the kidney. We see the stone, we send shock waves through it, we break it up, and we vacuum it out at the same time. So basically, it's typically a one-time deal, meaning you go under general anesthesia one time, we do the procedure, and you wake up thereafter. Sometimes you can go home the same day. Sometimes you have to spend a night or 2 in the hospital. Generally, you most always have a stent afterwards, which is a big, long, flexible plastic straw-like substance that fits in the kidney with a pigtail in the kidney and a pigtail in the bladder, and it runs the length of the ureter. So it's a big, long plastic straw to allow the urine and the debris to drain down the ureter and be expelled out the bladder. So, doesn't really sound appealing to most people, but sometimes that's the only choice that we have. Now, I particularly do a number of these procedures. I typically keep the patients overnight. What patients tell me they generally feel after one of these procedures is, aside from seeing a lot of blood in the urine and aside from experiencing some weeping around the incision in their back, they feel like they've been kicked in the back, or they've done a lot of exercise where they've been doing weights and the back muscles are sore. Some patients say that it feels like somebody has just kicked them right in that area. However, the discomfort is generally very manageable with Tylenol and ibuprofen, and sometimes with things like Norco and Percocet if the discomfort is actually a little more. So having said that, if you're somebody that makes kidney stones, or you're somebody who is having recurrent urinary tract infections, or you're having a lot of blood in the urine, certainly your doctor needs to order some imaging studies so that we know if you're making these Staghorn stones or not. Just with any other kidney stone, we typically have the patients go through what we call a metabolic workup, which means blood work and urinalysis for 24 hours to determine if the body is doing something to make these stones. They're also associated with recurrent urinary tract infections and can form as a result of multiple infections. So be aware. If you all have any questions, I love answering your questions. I hope this gives you a little insight into some different scenarios with kidney stones. We don't see it incredibly often, but we do see it enough that we treat it. So hope this helps. Have a great day, everyone, and as always, thanks for letting 360 Pelvic Health help restore your confidence.